Hey, future medics, and welcome to continuing on through our axial skeleton. Today we are doing the facial bones. And these are important because a facial injury is an airway injury until proven otherwise. So let's get into it. There are 14 facial bones, and they form the attachments for muscles so that we can chew and swallow and speak and have expression in our face. And you don't need to know every single one, but we are going to go over the ones that are important. All right, so let's try this. We're going to start here at the maxilla. This big yellow one here is the maxilla. Okay, and you'll see that it helps form the upper palate, and it also has your teeth in it. Okay, so this lower jaw here is the mandible, has teeth, and it's also the only bone of the skull that can move. Mandible, maxilla. Okay, those are two really, really big ones. And then let's look at this dark blue, purpley one. This is the zygoma, and it's your zygomatic bone, however you want to say it. It also goes posteriorly into the zygomatic arch, which articulates with the temporal lobe. This is your cheekbones. That's what this is, and it can break. It can, especially if you're in an assault, it can break. Now notice how medially it helps form the ocular orbit. That's important because if it gets broken, you might see that the eyes aren't sitting quite like they should. Okay, what are we going to do next? Yes, so I want to go over your nasal bone. It's this lavender one right here, lavender one on top of that yellow. That's your nasal bone. It forms the arch here of your nose. Now, if you'll look inside at this little pink one, that's your lacrimal bone. Easy to see because it's right at your lacrimal gland where you would have that tearing in your tear duct, because look, it's here in your arches, your orbits of your eyes, right? So inside here, you see this little green. This is going to be easier if we look at it here. Here you go. Now, that green is your vomer, and it forms your nasal septum. And if you look right above it, here you go, these dark blue ones are your palatine bones, and they form the roof of your mouth or your upper palate. Now, we've got one more small one. Let's see if we can show you. Yes, this little purpley one right here that looks almost like the turbinates of your nose is your inferior, right in front of it, your inferior nasal conchae, or it's concha, and if you're talking about both of them, it's conchae, which is so cute. I think it's such a cute name. And they help humidify air as it comes into your nose so that it's not dry and doesn't cause irritation in your lungs. So those are all of the really important facial bones. Sometimes some of them are a little easier to see down here. As you can see, we've got that sphenoid articulation, and we've got the bottom of these temporals here, and a huge part of the occipital, which we went over. And they all fit together to form all the structures of the whole head, but also to allow us to form the orbital sockets, to form the base so that our brain has something to sit on and it doesn't just fall through, and to form other articulations so that we can speak and smell and move and talk and have expression. Now, of all of these facial bones, the maxilla and the mandible matter a lot. Why? Well, because they have teeth, right? They form the opening also to the airway, the opening to your mouth. And so if we have trauma here and we lose these teeth, we can swallow them down our trachea into our lungs and have secondary problems from that if we don't choke in the first place. So these are a big deal. And a way that we can tell that there's a problem here is maybe our patient just cannot open their mouth to speak because this is broken, or we might see some missing teeth, which you should be worried. But you also might see malocclusion. So you see how the teeth fit together really nice. If this side is broken or even just dislocated for whatever reason, you're not going to see, the teeth are going to close sideways like this because this jaw is going to be hanging down. So you might see a gap over here where the teeth don't close. That should tell you that that side of the mandible is broken. Okay. Another thing that we might see is Obviously, swelling, trauma, deformity, things like that. But you might see flattened cheekbones. This guy is actually pretty thin. Let's see if I can look at that. That's really, really thin. That's really thin. That's pretty easy to break. So you might see where it's flattened, it wouldn't be holding that structure anymore. This would be fractured. If we're seeing heavy, heavy bleeding from the nose that just will not stop, I would think significant facial injury as well. But also with these things that help form the orbits, right? The maxilla does, the zygomatic does. If the eyes are not sitting equally, I would assume that some of these structures are also broken. Now remember, with these facial bones, because they sit right in front of our airway, if we have significant damage to them, we are going to suspect an airway problem until we prove otherwise. But if we have a lot of facial damage, right? They took a hit straight on or sideways, right? Probably rocked that spine that it was attached to. So if you're having significant facial damage, just like I said with skull damage, you should probably go ahead and do manual C-spine and hold them in center until we check it out and make sure that it's okay, because this is a lot of force that could probably rock you back really hard. Okay, that's it. That's it for the whole head. You did it. You understand where the bones are. You can see them, you can picture them, and you know the names. So we're going to keep moving down in our axial skeleton, and we're going to do the spine. I'm so excited to go over it with you. And then we're going to move to the rib cage, and then we are done with the axial and appendicular skeleton, and we'll move forward. You're doing a great job. I know this is a lot, but we're building little by little, and you're doing fine. I believe in you. Even if you don't believe in yourself right now, that's okay. I'll see you soon.